Hi.
Hi, Miss Penelope. How are you doing today?
I'm okay.
My name is Linda. I'm going to be your nurse for today. I'll be triaging you. What's the reason for your visit? Why are you here today?
Well, I'm 34 weeks pregnant and I think my water broke.
Okay, why do you think that?
It felt like I peed my pants.
Okay, how long ago was that?
That was an hour ago.
Okay, is this your first pregnancy?
No, this is my second. I had my son a year ago.
Okay, was your son full term?
No, I had him at 32 weeks.
Okay, how was your prenatal care?
Well, I didn't know I was pregnant until like 22 weeks, so I was still drinking and smoking cigarettes then. But I stopped once I found out.
Okay, how's your health been during your pregnancy?
It's been okay. I can't really remember. My doctor's back at home now. I wish I was there, but they said something about me having like high blood pressure because of the pregnancy or something like that.
Okay, I'm so sorry you're going through all of this. I know it must be much. It must be a lot, but don't worry, you're in good hands. Do you have any questions for me before we get started?
I think I have endometriosis too. I got a
Okay.
diagnosis 5 years ago. I don't know if that matters.
Okay, any other medical history?
I don't think so.
That's just it? Okay. If you do have your baby today, it seems like you'll be having a preterm newborn. If you have any questions, we can talk about it more. But I would like to get you in and evaluated, and we can talk about that more.
Okay.
Is that okay?
Yeah.
All right.
Thank you.
Hi, my name is Linda, Penelope's nurse. In her health history, she mentioned that she had hypertension and was diagnosed by her previous provider. She also said that she had a lack of prenatal care. She only found out that she was pregnant around 24 weeks, and during that time, she was drinking and smoking, which is also a risk factor for preterm labor. She also mentioned that she had a previous pregnancy that ended at 32 weeks, um, which means she has a history of preterm delivery. Some of the other risk factors of preterm labor consist of premature rupture of the membranes, adolescent pregnancy. Miss Penelope was 19 years old, and cervical incompetence. Lastly, placenta previa.
Common complications with preterm labor include respiratory distress syndrome, bronchopulmonary dysplasia, aspiration, apnea of prematurity, intraventricular hemorrhage, retinopathy of prematurity, patent ductus arteriosus, necrotizing enterocolitis, and there are additional complications including infection, hyperbilirubinemia, anemia, hypoglycemia, and delayed growth and development.
Hi, congrats! You had a beautiful baby girl.
Thank you.
Yep, she does need to go down to the NICU, but I'm gonna let you hold her for a moment before I take her.
Okay, thanks.
Yep.
Oh, she's beautiful. She's so tiny. Why is she so hairy?
So she has what's called a lanugo. It's something that many preterm babies have. It's just a soft, downy hair they have. It'll go away as she gets older.
Okay,
All right, but she does need to go down to the NICU.
okay. What's happening? Where are they taking my baby?
Hi, Penelope. I'm from the NICU. My name is Paige. I hear you have a couple questions.
I do. What's
know-
the NICU?
So I know this can be really scary. So the NICU is the neonatal intensive care unit. So it's an ICU that's specific for little babies like yours. Our focus is going to be on your baby's underdeveloped cardiac and respiratory system, and it's also important to note that preterm infants are at a high risk of hypothermia immediately after birth and on admission to the NICU.
Well, what exactly are you guys going to be doing to her down there?
So the first and foremost is we need to keep her warm, and to do that we're going to use something called an incubator, and that's just going to help regulate her temperature. And also considering your baby's lungs are not developed, we will give her surfactant, and that's just going to open up those alveoli and make it easier for her to breathe. And it's also going to be important to conserve her low energy. So we're going to minimize the stimuli in that room and kind of cluster her care together.
Will I be able to see her?
Yes, and we really want you to come see her. You are welcome anytime down in the NICU, and it's so important for bonding. Once your baby is considered stable, we really want you to be able to hold her, but it's all just going to be a matter of how she adapts. And just spending time in the room, talking, singing with her is nothing but beneficial to her.
Okay, thank you for explaining it to me.
You are very welcome.
The Ballard score in newborns is used to estimate a gestation age. This is based on the neonate's physical and neuromuscular maturity and can be used up to 4 days after birth. There are a few different parts of this examination. Starting with neuromuscular maturity, you take a look at the posture of the baby. A full-term infant should have their extremities flexed. You also look at the angle of their wrist. A full-term newborn should be able to put their wrist at a complete 0-degree angle. You also check for the arm recoil. A newborn's arm, when you move it, it should pop back to a 90-degree angle. You're also going to be looking at the popliteal angle, which is of the legs, similar to the arms. When you extend them, they should flex back to a 90-degree angle. You're also going to be looking at the scarf sign. You're going to see how far the arm can go over, and that is going to help assess the age of the neonate. You're also going to see how far the heel can reach to the ear. A full-term infant shouldn't be able to go past the umbilical cord. You're also going to be looking at the at physical signs for maturity. You're going to look to see if the neonate has lanugo. Full-term infants shouldn't have much lanugo. You're also going to be looking at the soles of their feet. They should have creases over their entire sole. You're also going to be looking for breast tissue. A full-term neonate should have a full areola and breast buds. You're also going to be looking at their eyes to see if they are equal in size. You're going to be looking at their ears to see if they are thick and stiff with instant recoil. And males going to be looking to see if the testes are pendulous with deep rugae. And in females, you're going to be seeing if the majora covers the clitoris and minora.
Thanks for letting me come to the NICU to see my baby.
Yeah, of course. Do you have any questions for me?
Well, what is this? What is she in?
So this is an incubator.
What does it do?
Because she was born premature babies have an especially difficult time thermoregulating. So we keep her in this warmer so that she can maintain the correct body temperature.
Okay, how's she doing otherwise?
She's doing okay. We've been running some tests and they've all been coming back positively.
Well, what tests have you done?
So we did a CBC, we've done a urinalysis, we did a test to check the bleeding. It's called a PT and an APTT. We checked her blood sugar levels, her glucose, calcium, bilirubin, as well as her ABG. So just checking her oxygen saturation and her carbon dioxide levels.
Okay. Is there anything I can do now to start preparing for when she comes home?
Yes. Do you have a pediatrician in mind?
No, I don't think so. Can you recommend one?
Yeah, I can recommend one in your town. And you're going to want to make those appointments as soon as you can, and just be sure to maintain those appointments and go to all your follow-ups.
Okay. Thanks for your help.
No problem.